Welcome to the Manual TherAPPist. To create a new medical file for a patient, tap on Patients. By tapping on the plus sign, a window will pop out for you to fill out the patient's surname. You can then tap on the check sign to fill out the patient's personal data. At first, you need to obtain consent from the patient regarding the entry of their data into the application. After the patient has signed, you can tap on the empty space and then tap on the return icon. A window will appear. Select Yes to finalize the signature. By returning to the personal data screen, you can fill out the name, gender, date of birth, height, weight, contact data, and other data such as profession, medical diagnosis, hobbies, main problem, and other. The main problem is the patient's chief complaint. You can also choose to take a photograph of your patient. The subjective examination is the first step of the clinical assessment. By tapping on the body chart, you can draw the patient's symptoms using a color of your choice. You can also choose a pencil width from the available options. With the red cross, you can mark the areas with neurological symptoms. With the green check, you can mark the areas that are clear of symptoms. By tapping on the camera symbol, you can take a snapshot and drag it to any part of the screen you want. To finalize, tap on the empty space. By tapping on the white folder symbol, you can add a custom note by using the keyboard or the drawing tool. You can also drag this to any point. Tap on the return symbol and go back to the main menu. Select Main Problem to see a list of basic questions for the symptom description. You can add an asterisk to answers to mark them as important. Accordingly, you fill out questions that are relevant to symptom description, special care, autonomic nervous system. Tap on the return symbol and then tap on the body chart to place the information regarding symptom 1 at any spot that suits you by dragging and dropping the text box. Upon returning to the main page, you can tap on plus sign to create a new symptom. You can follow the same routine to draw the symptom on the body chart. By tapping on the new symptom, a list of new questions will appear, which you can fill out in the same manner as before. Next in the subjective examination are the extra questions. You can add here the symptoms relations. Wherever the light bulb icon is available, there is relevant information for that specific topic or part of the examination. You can also fill out the safety questions and the activity restrictions. You can slide to the right in order to grade from 0 to 5. Depending on your answers, the relevant flags will light up. On the top part of the screen, over the body map, there is an Edit option. By tapping on that, you can choose among several body charts or remove one that you don't need. Continuing with the subjective examination, there are a few more categories you can ask questions from. 24-hour behavior. Bear in mind that it is up to you to decide which fields you want to fill out. You can tap on the asterisk sign to mark information as important. On any page, you can add a custom note by tapping on the pencil symbol, which is on the top left part of the screen. By tapping on the plus sign at the field you want to add your notes, a window will pop out for this purpose. You can mark important custom notes as asterisks as well by tapping on the asterisk sign. You can fill out the 24-hour behavior for each symptom. The next category are the screening questions. They are specific to the body region in question. You can tap on the plus sign on the body region you choose and select among the preset choices, or tap on Other to add a custom note. Following is the symptom history. In the current history, you can choose among traumatic incident, idiopathic onset, and answer the corresponding questions. You can also fill out data regarding medical care and medication. When an answer poses a possible risk factor, then a red flag will automatically light up. You can also fill out the past medical history following the same routine. You can take a snapshot of the investigation images your patient might have and add a title to it by tapping on the pencil. You can also draw on the photograph by tapping on it and selecting the drawing tool. The next category is general health. You can do a quick examination or ask questions per system. With the quick examination, you can choose among common symptoms, diseases, and habits. You can tap on the plus sign on the category you want to select from the list. With the questions per system, you can tap on the plus sign to view the questions for this given system. In this way, you can reduce the chances of omitting to ask something important. The final category of the subjective examination is the patient's opinion and has to do with the patient's thoughts regarding his or her problem. At this stage, you can also record the contributing factors and the patient's goals. You have now completed filling out the subjective examination. Tap on the return sign to go back to the main menu of the patient's file. Following the subjective examination, the next step is the planning physical examination. Upon entering this page, the information regarding the planning pops up. On the left sidebar, you can have access to the information of the subjective examination grouped in categories. By tapping on the asterisk sign on the top part of the screen, you have the option to choose a display between asterisks and questions. By tapping on the icon on the left of the asterisk, you can choose the answers of a specific category to be displayed. On the main screen, you can see the categories of the physical examination planning. Fill out the information you find relevant by tapping on the empty space on the right side of the question. Depending on the user's answers, the application will provide with some precautions and contraindications. You can then fill out the main hypotheses. You can use the secondary hypotheses if you wish to draw a hypothesis tree by using the drawing tool. Next, you can choose which categories of the physical examination you plan on performing on the first session. The physical examination planning is complete upon filling out the positive and negative prognostic factors. By selecting the Physical Examination tab, you can enter its menu. The answers from all stages of clinical assessment so far can be viewed on the left sidebar. By tapping on the category, the relevant fields for the user to fill out will appear. You can always choose which fields to fill out. It is not mandatory to fill out all fields of the physical examination. Observation is categorized as general, regional, and local. The program will provide with some possible answers for the body part under observation. You can then either select one of the provided possible answers, or Other can be selected for a custom note. As with a subjective examination, you can tap on the asterisk sign to add an asterisk to an important finding. On functional demonstration, you can record a movement or position which reproduces the symptoms. By selecting the active movements, a list of body parts will appear. When you choose one, the possible movements of that body part will appear in a list. You can add a custom note if you need to do so. You can select as many body parts as you need. With optional tests, you can choose a category, and then by tapping on the right, you can enter your answer. With neurological examination, there is again a list of body parts. You can, for instance, select the upper limb and choose which subcategories to fill out: sensation, muscle strength, reflex. Wherever you see the light bulb icon, you can tap on it for relevant scientific information. On the bottom of the list is the testing for upper motor neuron lesion. Each test has information with instructions. There is also the option for the user to fill out the dermatomal map by using the drawing tools as with the body chart. With a neurodynamic examination, you can choose between the upper and lower limbs, left or right. The corresponding tests will appear. By tapping on the light bulb icon, scientific information and help regarding their execution will appear. As always, it is up to the user to decide on which fields they need to fill out. With passive physiological movements, choose a body part and the corresponding movements will appear in a list. The procedure of filling this out is the same as for the other tabs. The next tab is Palpation. You can fill out the relevant fields or make a custom note by using the pen. On the Muscles tab, you can type in the muscle you wish to examine. Some fields will automatically appear for you to choose or add a custom note. On the Passive Accessory Movements tab, you can select a new body part by tapping on the plus sign, and following that you can select the area and then the level. A table will appear in which you can fill out technique, position, grade. By tapping on the light bulb, you can access some information about the grading system. You can continue with filling out mobility findings, symptom onset, pain, resistance, and spasm. If you wish, you can add a movement diagram. By tapping on the empty space, you will see the entire summary of the passive accessory movements in one table. You can use the plus sign on the left of the screen to examine additional body areas. The rest of the tabs are orthopedic tests, muscle strength, muscle length, motor control, and objective outcome measures. You only need to name a test, and then by tapping on the empty space on the right, enter your answer. After you have named a muscle, you can grade its strength from 0 to 5 by sliding to the right. The physical examination is now complete. Examination summary. At this point, you can see what you have recorded so far, summed up in one page as you have entered it. On the left column, you can see, sorted by category, the patient's personal data and subjective examination. On the center column, you can see, sorted by category, the physical examination planning. You can also see the contraindications to treatment. On the right column, you can see, sorted by category, the physical examination. On the bottom part of the screen, you can see the dermatomal map and any snapshot you might have taken of an investigation, such as an MRI. By tapping on the asterisk sign on the top right, you can opt to only see what you have identified as an asterisk sign in each category. You can tap on the symbol on the top left corner of the screen to email this page. The examination summary is a summary of the answers and important points, all in one page, and is a useful tool for the clinician. When you enter the treatment page, you will be able to view all the answers that you have provided in the clinical examination. By tapping on the symbol on the left of the asterisk symbol on the top of the screen, you can choose to view the answers of a specific category. You can exit the treatment menu and take a shortcut to any other part of the program by tapping on the symbol on the left of the plus sign. By tapping on the plus sign, you can create a new treatment. In the new treatment, there are the methods of treatment. By tapping on the plus sign, you can choose whether you want to use the preset form or make a custom note. By tapping on the form, a table appears. You will be asked which asterisk signs you want to reassess. After you do this, they will appear in categories. You can then enter the technique, or you can select Other in the existing techniques and make a custom note. You can, for instance, select to perform a PA. You would then fill out the position. It is not mandatory to fill out everything. You can add body region, grade, rhythm. You can also enter the symptoms response to the technique. If, for instance, it appears in the beginning of the movement, if there is pain, resistance, or spasm, you can opt to draw a movement diagram. With the asterisk reassessment, you can note the outcome of the technique by assessing again the asterisks. By tapping on the blank space, you will see all the information summarized in one table. In this way, you can always be in control of what you have done in one treatment and what the response was. With a custom note option, you can enter any information you find relevant. For instance, the execution of a right unilateral PA on L5. flexion was better on reassessment. The program will list the methods on the right. Similarly, you can note exercises either with the use of the form or a custom note. On the left of the screen, following the exercises, you will see the manipulation consent form. On the top of the consent form, there are recommended contraindications, and the therapist can inform the patient for the specific body region and obtain consent. By tapping on the return sign, the program will ask for confirmation to finalize the signature. Following the treatment documentation, you can choose to plan the next treatment. You can note what you would like to do in the physical examination, which asterisk signs from the subjective and physical examination to reassess, what treatment methods and/or exercises to use. By returning to the main menu of treatments, you can tap on the plus sign to create a second treatment. By entering that page, you can see on the right side of the screen the treatment plan that you have created in advance. You can also see the contraindications to treatment in red. On the left side, there is a question, "How are you today?" You can also make a custom note. Following this, you can reassess the asterisk signs of the subjective and physical examination and move on to the next treatment. To return to the main menu, tap on the return sign.